Good morning. My name is Dominique.
Ken.
And we'll be talking about symphysis pubis dysfunction, well, interventions for it. Okay. So our objectives: review the definition of SPD and its causes, discuss 3 impairments for it, identify supporting interventions, demonstrate each intervention, and explain how each intervention will provide benefits. You can reference this in Dutton on pages 1410 through 1411.
So, what is SPD? It is when the ligaments stretch, permitting bone movement. Another name for it is DSP, which is partial or complete rupture, and it commonly occurs during pregnancy, and it's characteristic pain and hip flexion with legs extended, and it typically resolves in 6 to 8 weeks. So let's get into those problems and supporting interventions. But before that, let's talk about those special tests. So as we know, all of these, before we start our interventions, we're going to do those special tests, which includes the Faber, distraction test, and compression test, to just basically rule in SPD. So impairment 1, we have muscle weakness. So some interventions for this during the max phase is just patient education, aquatic therapy, a posterior pelvic tilt, and stabilization exercises. During the moderate phase, we're just continuing those, and then during the minimal protection phase, we're doing the farmer's carry step up with dumbbells or single leg stand with dumbbells. And these are those pictures. Okay, so for the max protection phase, let's go ahead and do that pelvic tilt. Have your patient up on their back, and of course, you can bring your knees up if you need to. I like to put my hand under the patient to make sure they're actually doing the correct motion, and just tilt your back, to my hand, just making sure that pelvis goes posteriorly. And this will help with activating the core, hip, and pelvic floor muscles with minimal movement. And then during the moderate protection phase, we can do basically the same thing, or just have them, you can stand up. Since we talked about aquatic therapy, just have her do a mini squat, which is basically doing the same thing, just promote neuromuscular control. And then during the minimal protection phase, we don't have any dumbbells, but we're gonna pretend these are dumbbells. These are our pretend dumbbells. Just have you carry them while walking. This is that farmer's carry we talked about. And this is basically just enhancing core pelvic stability and improving single leg strength and balance and reinforcing functional movement patterns. Great job.
All right, our next impairment is the inability to climb stairs. All right, so for the max phase, we're gonna stick with the patient education. You can still do the posterior pelvic tilts, but since we did that in the last one, I'll do the glute bridges, and this will just help for external stabilization and external stabilization of the pelvis. Then for the moderate protection phase, we do some step-ups, balance training on stable and unstable surfaces or seated marches. This will help improve muscle strength and coordination. And for the minimal protection phase, we can do some functional stair training or an obstacle course. And this would be to restore the normal biomechanics and, real life scenarios. All right, so for the first one, bridges, I'm gonna have you on your back. And you're going to squeeze your butt cheeks while you come up to the top. Hold that position for about 3 to 5 seconds and then come back down. And you can do about 3 sets of 10 of those. Then some seated marches for the, all you're gonna do is march in the seats. Like I said, this will improve muscle strength and coordination. And to progress, you can add some ankle weights or have them eventually stand up. And then for the minimal protection phase, we can do an obstacle course. I don't really have a lot to do an obstacle course with, but have some cones here. And then our steps. So I'm just gonna have you walk over or step over each cone, and then when you get to the top, step up on that as it's your step. And then down. Great job. It will be more complicated in the real life scenario for a clinic, but this is what I have. All right. Our pictures of all of those. All right. And the third one, we have limited hip range of motion. So for the max phase, we'll do passive range of motion, active range of motion, some ice or clamshells. This will be to maintain joint mobility without exacerbating the pain. Cryotherapy can reduce inflammation, and the clamshells will help with strengthening the muscles. Then for the moderate protection phase, you could do a 4-way hip or some side steps. This will be a gradual improvement while also strengthening the joints and restoring normal range of motion. And then for the minimal protection phase, you can do lunges, squats with or without a ball, or a leg press if your clinic has one. And this will restore full range of motion for daily activities, improve flexibility, and prevent stiffness or compensatory movement patterns. So for the max phase, I'm gonna have you lay on your side, and we'll do the clamshells. So great, you're just gonna lift your top knee up without rotating back. 3 sets of 10. Great for that. My phase, we're gonna do the 4-way hip. Actually, no, we're gonna do the side steps. I'm gonna wrap this around you, maybe. Definitely not how I thought this was. So I'm just gonna tie this. All right, it will be tighter, but you're gonna have a mini squat, and you're just gonna step out to your side. And this will gradually improve the muscles of the hip joint. And then last but not least, we will do some lunges. So with either leg that you want to lead with, you're just going to do a lunge, ensuring that your knee does not go over your toe. Great job. This is more functional. Okay. Of that, and then our references. Are there any questions? Yes.
What's another exercise you can do for the second impairment in the minimal protection phase?
Okay, give me 1 second. The inability to climb stairs.
Yeah.
No, what you could do the functional stair training, because that is what they can't do. And so just working on those, going up, ascending and descending stairs, and sideways as well, because you never know, children have toys on the floor. This happens with people who just have babies, so yeah, right.
How can you modify, go to the third impairment, I think it was on that one. How can you modify the 4-way hip if that's bothering them?
Have them on the table, because for that one that's standing, so I'm doing active range of motion, I can add a resistance band. On the table is less gravity, pulling it down or causing more difficulty.
Okay.
Thank y'all. That concludes our presentation.